Okay, so we're going to get started. We're going to start first. We have quite a few presenters, but we're going to start first with Danny Kwan and his team over at Centerlight. So I'm going to pass the permission over to Danny. Just bear with me 1 second. All right, Danny, you should have permission.
All right, give me 1 moment. Are you able to see my screen?
Not yet, Danny.
No?
Not yet.
Sorry about that. Give me 1 second. All right. My apologies. Sorry about that. I'm having a little technical difficulties.
Here, Danny, I'll share the screen for you, and that way you can talk over your presentation. Let me just share it right now.
Sure.
Hold on 1 second.
Thank you.
Yep, just bear with me 1 second. There we go.
Amazing. Awesome. Thank you very much for that. All right. So welcome, everyone. Thank you for taking the time to meet with us today. I'm really excited to be here and talk to you guys about the PACE program, which stands for Program for All-Inclusive Care for the Elderly. Now, we're a model of care that's really specifically designed for seniors who require assistance at home with their day-to-day activities. Now, our mission at Centerlight is to ensure that our participants have the opportunity to live in their homes and to be a part of their communities for as long as possible, while also ensuring that they're happy, but most importantly, safe. And the way that we accomplish our mission is with the help of our interdisciplinary team, or IDT as we call it, which is a team of professionals that are on site every day to assist our participants and to discuss the care that each of our participants receive. Interdisciplinary is another way of saying working together, and that's exactly what this team does to provide the utmost care that our participants need. My colleague Stephanie Louie, who is one of our clinical service directors, will give you more insight into the IDT team right after this portion. All right, can we move to the next slide, please? Thank you. Beautiful. All right. So the PACE program is actually a site-based plan, meaning that our participants can use not only our services, but also have access to our facilities as well. Our centers are both a clinical hub, meaning we have doctors, nurses, and clinicians on site, and a social hub, meaning we also provide a social adult daycare center with programs and services designed for senior citizens. We can provide a home attendant to come in the morning to help your loved ones get ready to come to our site. We provide transportation to and from our sites, as well as all medical appointments. Now, I know that some of you may already be aware of the transportation services and maybe getting them through Access-a-Ride. But I do want to take this time to point out that with us, you'll be receiving a car service that'll take you directly from your house to your appointment. And once your appointment is done, directly take you from your appointment back to your house. For those who have been in an Access-a-Ride van, I'm pretty sure you guys have had experiences where you guys are waiting in the car for a very long time. So that it completely eliminates that wait time with us. There's also daily activities for our seniors at the sites, such as dancing, sing-alongs, yoga classes, music lessons, arts and crafts, and many more activities that'll keep our seniors both engaged and stimulated. We provide breakfast and lunch to all participants, and even a take-home dinner for those who may not have someone to cook for them at home. They can come to our site, have fun, and enjoy time with their friends while getting their physical therapy done right next door in our clinic. We also have a doctor on site in case your loved one is not feeling well. Our doctors can assess them very quickly without a long wait in the waiting room and take the steps necessary to ensure your loved ones are safe and sound. We even have monthly trips for the seniors to the, botanical gardens. They go out to local restaurants for lunch, and they've even gone to the World Resort casinos in the past as well. So this is really an amazing opportunity for your loved ones to go out, kick back, and have some much needed fun. Once they're done for the day at our site, we'll provide transportation for the ride back home, and the home attendant can meet your loved ones back at home so they'll have someone looking after them throughout all hours of the day. Now, this is a huge benefit because many of you have full-time jobs, and it really may be concerning to leave your loved ones at home with no assistance. All right, next slide, please. So all of these services that I just explained are designed not only to benefit our participants physically and mentally, but it's also to give you caregivers such as yourselves some well-deserved peace of mind. I actually care for my father as well, so I understand how difficult it can be to focus on anything, especially those days when our loved ones are not doing so well. So, I hope it's a reassurance when we say that our staff are ready and willing to help you and your loved ones out. So to help you kind of get some peace of mind, rest assured that you'll have a team of professionals who are there to assist you and your loved ones around the clock. You'll receive door-to-door transportation, which means that they'll pick your loved ones up from the front door, and after the appointment, drop them off at the front door. And your loved ones will also receive home care and a wide range of at-home services, all the way from medication management to medical equipment installations like shower grab bars and things like that. Also, as a Centerlight participant, your loved ones will have access to our warm and welcoming centers, which are excellent for socializing. Next slide, please. So all of our participants have a designated participant experience manager who will provide a concierge service to your loved ones. They'll be greeting your loved ones when they join. They'll be hand delivering ID cards and OTC cards after enrollment. And they'll be your point of contact for any and all issues that you guys may experience. They'll be around friends and staff that are dedicated to helping them throughout the entire day. You'll have constant communication from the interdisciplinary team so that you're never left in the dark about your loved one's cares. And last but certainly not least, we work very closely with Premier Home Care to provide you with the CDPAP option, where a family or a friend can provide home care to your loved ones and get paid to do so. This is an amazing program, especially now during these difficult times, as many people in our communities are losing their jobs. Megan and Joe from Premier will provide you with all the information you need on the CDPAP program shortly. And lastly, all of our participants have access to an amazing ambulance service called Assist Ambulance. If your loved ones are not feeling well, or if there's an incident such as a fall, Centerlight participants have the option to call Assist Ambulance, who'll send an EMT directly to the homes and treat them right then and there. So the reason why this is so great is because it's going to prevent any unnecessary hospital visits, potentially exposing you to COVID-19. So Next slide, please. Thank you. So if you look here, these are some of the services that the EMTs can provide at the house. And if further medical treatment is required or the injury is severe, they'll take your loved ones directly to the hospital without hesitation. Next slide, please. All right, so you're probably asking yourself where our centers are now. We have a total of 12 full PACE centers with doctors, nurses, and physical therapists, and 2 alternate care settings that are solely focused on the social adult day care aspect. We have an extensive coverage area to ensure that you're never too far away from a Centerlight PACE center. We cover all 5 boroughs, along with Westchester, Nassau, and Suffolk County. And if you'd like for me to check if your loved ones reside within our coverage area, please reach out to me after the workshop and I'll gladly check that information for you. Next slide, please. Awesome. All right. So now, as wonderful as it will be for everyone to be able to join the PACE program, there are some qualifications that need to be met. The first is that you must be 55 years of age or older. You must be residing within our coverage area. You must need assistance with your daily living activities, such as getting dressed, eating, or food shopping, things of that nature. And in terms of Medicaid and Medicare, all you need to enroll with us is Medicaid. If you do not have Medicaid, we assist with all Medicaid applications. We'll help you fill the application out and collect all necessary documents. Once completed, our Medicaid specialist will hand deliver the application directly to the Medicaid office. If you don't qualify for Medicaid due to income, we work very closely with Mark from SCS Pool Trust, who'll be giving a fantastic overview of the Pooled Income Trust program in just a bit. Next slide, please. Great. So the key difference that makes us stand out in the market is really how in-depth and hands-on our approach really is. And at this time, I'd like to open up the floor to our Clinical Service Director, Stephanie Louie, who'll be highlighting the interdisciplinary team and what makes us different from other managed long-term care plans.
Thank you, Danny. Hi, everyone. My name is Stephanie Louie. I'm one of the clinical service directors at one of our PACE sites. I work mainly out of the Flushing location in Queens. And just to give you a little bit of background, I am a nurse myself. So I just want to tell you what Centerlight can offer, your family members in terms of care. So what is Centerlight Team Care PACE? And PACE stands for Program of All-Inclusive Care. So if you join our program, we act as your insurance company and we also deliver the care. So you would use Centerlight as your insurance company, and we're also providing you the full interdisciplinary team. So you would have a nurse on your team, a physical therapist, an occupational therapist, a doctor, a social worker. We have recreation specialists that do activities. Let's see. I'm sorry, I'm just want to make sure I'm not missing anyone. So we have a doctor, a nurse, social worker, physical therapist, occupational therapist, recreational therapist. We have a dietitian on staff. We have home care coordinators. They're the ones who would be working with Premier to help you get an aid into your home to help your loved ones. We have transportation, and then we also have staff at our centers to help your loved ones while they spend their day there. So how is PACE different from other managed long-term care plans? Other managed long-term care plans, they might only provide you a nurse visit once every 6 months. At PACE, the minimum visit is monthly or even more. It depends on what your loved one needs. If they need medication management every 2 weeks, you'll have a nurse, a registered nurse in your home every 2 weeks. If they have a wound that needs addressing, they can be in your home up to every day of the week. 2 times a day, 2 times a month, or 3 times a month. But minimum would be at least once a month versus other care plans are once in every 6 months. You'll also get a full assessment every 6 months from the full IDT team. So every 6 months, everyone will come to your home and do a full assessment to see what their needs are for the next 6 months. If they're on therapy program, or if they're getting home therapy, they'll see the therapist more frequently. How does your PACE team work together to develop a custom care plan? So in PACE, there's something called care planning that we do every 6 months. That's when they come and do a full assessment. After everyone's assessments, we come to a table and we sit in a conference room. We discuss what the issues are, what they need help with, what our concerns are, and we develop a care plan. This is something unique to PACE. Managed long-term care plans don't have this. And this is one of the requirements of PACE. So this is a guaranteed meeting that occurs every 6 months for your loved one. At this meeting, every person of the IDT team is sitting at the table and they give their input, what we need to adjust. We review their medications. We review if there's any supplies that they might need in the home, if they need diapers, wipes, chucks, or if they need nutritional supplements like Ensure. This is all discussed and we put a plan in place. Everything gets ordered by the nurse and arranged for the next 6 months. Roles of a nurse under PACE. So these are some services you can expect to receive from your assigned nurse. They can come and do medication administration. They can pre-pour medications for your loved one if they live alone and they only have an aide and you don't live nearby. The nurse can come and pre-pour their medications into like a pill box. They can set it up for every 2 weeks so that there's no risk of your loved one mixing up their medications. So that's one thing they can help with. If they have wounds or injuries, the nurse can come and help with the dressings and cleansing of the wounds. We also administer vaccines. So we can give them the pneumonia vaccine, the flu vaccine. They can come into our center to get the flu vaccine, or the nurse can bring it to the home and give them the flu vaccine at home so that they don't have to come out. They make monthly or more visits per month, depending on what the needs are. They monitor their weight, their vital signs at every visit. They also coordinate care with the rest of the IDT team. So let's say the nurse is in your home and your loved one tells her that she received a letter from Medicaid. She doesn't understand what the letter says. Our nurse will then reach out to the social worker and coordinate the care. The social worker will now come and help them with whatever paperwork that they have or questions or applications that they might have. A lot of our participants, if they receive a bill or something like that, the social worker can help them out with that. We also provide education to caregivers and participants as well. So if you do live with your loved one and let's say you want to learn how to do the wound care or you want to learn how to do insulin administration, our nurse can provide you the education so that you're able to perform it on your loved one as well, if you wish. We also have a clinic that Danny mentioned at each of our PACE sites, and we call it the DTC. It stands for Diagnostic Treatment Center. It's basically a doctor's office, but we only see Centerlight participants. So they're not competing with outside people sitting in a waiting room. They're never going to wait like 1 or 2 hours, where if you go to a doctor's office, that could happen to you. At our PACE sites, we only see Centerlight participants. So the wait time is cut down. Our nurses are there if they're coming in for an appointment to see the doctor, but they also wanted to talk to the social worker about something else. We can coordinate all of that so that they're not running to many different offices. When they're at our center, they can get all their services on the same day. They can see multiple members of their team right there in our center. So that's another plus. Our nurses are available Monday to Friday, 9 to 5. But after hours, if you do have a question, we have a call center that's open until 8 p.m. After 8 p.m., if let's say someone fell and they need medical advice, we always have a nurse manager that's on call 24/7. We also have a doctor that's on call. So anytime after hours, the phone line is always open and you will always be able to reach somebody for help. Let's see the next slide. So again, here, this is just listing all the members of the IDT. You have your doctors, your nurse, your therapist, your social worker, your nutritionist, your transportation coordinator, your home health care aide, and the participant experience advocate. Next slide, please. Okay, so that's the end of my presentation. I'll be happy to answer more questions I'm sure you guys will have at the end related to nursing care or the care that you'll receive in the home. This is Danny's information if you want to just jot it down really quick, but we're going to be on for the remainder of the presentation to answer all your questions at the end. Thank you.
Amazing. Thank you very much for that insightful information, Steph. At Centerlight, we're here so that you and your loved ones, can focus not on age and sickness, but in health and wellness. And we're definitely here to help you. So if you have any questions regarding the PACE program, or you simply want to check if Centerlight will be a good fit for your loved ones, please don't hesitate to reach out to me. I can answer all of your questions. And my contact information is up there, so give me a call anytime. Thank you.
That was a great presentation, guys, and great teamwork, sharing the slide and the vocals between the two of you. That was great. All right, so now we're going to move on to Joe Policastro, who is the Director of CDPAP Services over at Premier Home Healthcare. And like Danny and Stephanie mentioned, we work very closely with Centerlight and their team. We like to make sure that the services are, there's continuity of services. Nothing slips through the cracks. We're all like a well-oiled machine. We all work together. So Joe's just now going to talk a little bit about specifically CDPAP, the Consumer-Directed Personal Assistance Model of home care. And like we mentioned earlier, if you have any questions, and I do already see questions coming in privately to me, I'm jotting them down. We're going to address all questions at the end. So feel free to shoot them over as they come up in your head during the presentation, and we'll answer them at the end. Okay, so let me just pass over the permission over to my colleague, Joe, and then we'll get started.
Thank you, Megan. And thank you, Danny and Stephanie, as well. That was great insight on the PACE program. And we do love working with you guys. So thank you for that. And I hope that everybody is having is staying safe during these COVID times. And I'm glad that we are able to provide this value and give you guys some insight into these different long-term care programs. It's my pleasure to show you guys a little bit about the CDPAP program tonight. So it's a consumer-directed personal assistance program. It's an innovative program in New York when it comes to home care, and it's known for a lot of different things. And before I get into it, as Megan mentioned, please jot down any questions that you may have. Whether you are somebody that is new to this program, if you've never heard about it, or if you have heard about it and you're looking for more details, we are here tonight to help you out with that. So the Consumer-Directed Personal Assistance Program, this is a Medicaid-funded program, and it allows for those that need help with personal care, home health, or nursing level of services to hire, train, and even supervise and terminate if it comes to that, the personal assistance, which is the name of the caretakers in this program. This program really gives individuals and the families more control over the care. They have the power to decide who comes into their home and who takes care of them with those very personal tasks that have to be done. So it can be a family member, it can be a friend, it can also be somebody in the community. And this program was created by individuals with disabilities for those with disabilities. a group of individuals in the 80s came around a kitchen table and they decided that they wanted more control over their own care. And that's really the fundamentals of this program. And it actually started here in New York State, and this sort of consumer-directed model has since branched out into other states throughout the country. And actually, California is actually, they really use this program even more than New York does. So, it just shows the impact that, this program has across the country. And before I get more into it, I would like to start off with some of the terms so that it's a little less confusing, when you see the rest of these slides here. So CDPAP, as I mentioned, that's the acronym for the program itself, Consumer Directed Personal Assistance Program. Consumer directed meaning that the consumer, they're the one that directs their own care. Personal assistance, a personal assistant, that's the individual that is the caretaker. It's sometimes referred to as CDPAS, so that just refers to the services that are within the program. And the consumer, that's the individual that is receiving the services. And a consumer can be either considered self-directing, or they can, or if they're not self-directing, if they're not able to take on the responsibilities under the program, if they're not able to manage the personal assistance, then there is what's called a designated representative. And that designated representative doesn't have to be a family member. It can even be a neighbor, somebody that is approved by the health plan or social services that is able to manage the program for the consumer. So, that just gives you an idea that, there doesn't have to be a designated representative, please, but only if the consumer is not self-directing, only if they're not able to manage the program. As I mentioned before, the personal assistant, that's the individual that is caring for the consumer under the direct supervision of the consumer or the designated representative. And Premier Home Healthcare, we are the CDPAP agency, also known as the fiscal intermediary. And we primarily take care of some of the wage and payroll processing, but we're also there to assist the consumer in managing their own care. Because, sometimes this may be the first time that the consumer or the representative really is a manager or a boss in this sort of fashion. So that's why we always try to provide as much support as we can. And even if they were a manager in the past, being a manager in healthcare and in home care and overseeing personal assistance, that's a whole different world. So we are here to really help the consumers thrive within the program. So consumer eligibility. So who is eligible for this program? Now, as a fiscal intermediary, Premier Home Healthcare, we don't come up with this, right? This is decided on the entities that administer the program, like Centerlight, a managed care plan, or for those that are straight Medicaid, it's the local Department of Social Services, or HRA in New York City. And to be eligible for CDPAP, as I mentioned before, the individual must be on Medicaid. So this is not a Medicare funded program. If they're on Medicare and Medicaid, then they can definitely receive CDPAP services, but they would have to at least have Medicaid. They have to be eligible and require some or total assistance with home care, personal care, or nursing level of services. Along with that medical condition has to be considered stable. And because this program does give more responsibility to the consumer or the designated representative, right? Because they're the one that manages the program. It's not Premier Home Healthcare. We aren't the ones that are recruiting and training. That responsibility is the consumer's responsibility or the representative, right? So along with the other eligibility requirements, one of the requirements is that they have to be willing and capable of carrying out those responsibilities. Now, if if they do meet the eligibility requirements, the health plan, like Centerlight or social services, if the individual is straight Medicaid, they will have the individual complete a physician order form. So it's a medical form. It's almost like the doctor giving a prescription for CDPAP services. It's the doctor, writing down the permanent diagnosis and other medical conditions, right? And once that form is completed by the consumer's doctor, then it's sent to the health plan. The health plan is then going to review it, and they're going to send out a nurse to assess that individual for CDPAP services. And that's really the beginning stages. So for everybody on the call that is brand new to CDPAP, this is very important, right? That's the first step. The first step is to get that medical form filled out. And you can even email me. My email is on the flyer to this event, and it's also going to be at the end of the slide, and I can forward you that form so that you can have the doctor start to fill that out for you. And then once that form is filled out, then the nurse from the health plan or social services does the assessment. After the assessment, they'll hopefully approve CDPAP and a bucket of weekly hours that you can then use to schedule a personal assistance. Now, since we're coming to the personal assistance stage here, this is a very important slide, right? And I would say this is where a lot of questions do come. Who can and who cannot be a personal assistant in CDPAP? As I mentioned before, personal assistant, that's the individual that is caring for the consumer. Now, it is interesting because the regulations in CDPAP do not require them to have any specific certifications. So they can be doing nursing techs or helping the consumer with their ADLs and stuff like that. And, all of that training and really how they perform those tests is determined by the consumer or the representative. And some may see this as unsafe, or maybe it's, maybe they should get training, right? But then we have to think back to the fundamentals of this program. You have mothers and fathers of children that are disabled, right? Or you have seniors where the son or daughter are taking care of them probably better than any nurse can, right? Or just as good as a nurse can, right? So why should they have to get trained by somebody to help their loved one? So that's the fundamentals of this program. And that whole screening and the interview process is totally up to the consumer or the representative. Now, over in the green box, these are the individuals that are allowed to do personal assistance. They have to be 18 or older. They can be a relative, friend, or somebody in the community, even if they live in the same home. And the parent of the consumer, when the consumer is 21 years or older. And even if there's a circumstance where the consumer is under the age of 21, keep in mind that the personal assistant can still be a brother or sister that's 18 or older, or uncle, aunt, cousin, stuff like that. But it cannot yet be the parent until the consumer turns 21. And over to the red box, these are the individuals that are not allowed to be the personal assistant. So if they're younger than 18, they cannot be the personal assistant. The designated representative, so the individual that manages the program, signs off on the timesheets, they cannot also be the personal assistant. So the way to kind of think about that is you can't be the manager and the boss, and you can't be the employee at the same time. So younger than 18, designated representative, they cannot be the personal assistant. The legal spouse cannot be the personal assistant, and the parent, if the consumer is under the age of 21, cannot be the personal assistant. And if you have any questions about this, you can just jot it down in the comment section, and I can answer at the end. Now, we went over the eligibility requirements. We went over who can and who cannot be the personal assistant. But what comes after that, right? Well, once the consumer gets approved for the services and they know who the representative is and they know who the personal assistant is, then they have to enroll into a fiscal intermediary. Now, as I mentioned before, that's just a way of saying a CDPAP agency. And for those that are maybe have individuals that are in OPWDD, don't get us confused with the self-direction fiscal intermediaries. It's a completely separate entity. Now, one thing about Premier is that we're actually the only fiscal intermediary in New York State that provides CDPAP services that provides the $11.99 union benefits. So this includes the health benefits, education fund, and the paid time off, along with that advocacy that comes along with being a part of the union. And this is something that we see a lot of the personal assistants really take advantage of, because, especially for those that are looking to, hire personal assistants outside of the home, right? Maybe they're looking in the community for somebody that could potentially help. The better the benefits and, the better, the benefits for the personal assistants, really that, those incentives help with, personal assistant, retention and keeping them, caring for your loved one. Because we really want to make sure, and we really put a lot of effort into making sure that the personal assistants are taken care of and they get paid on time, and that we also provide as good customer service as we can as a CDPAP agency. And we understand the lengthy process that you may have gone through when it comes to getting on Medicaid or and other long-term care, processes, and we understand that, and we want to make this process, this CDPAP process, as easy as possible. We don't want to complicate things because we know that you have other things going on in life, and it could be very overwhelming, the paperwork and stuff like that. We have a fully online application, so you don't have to worry about coming into our office. And, this is something that can be done totally at home, especially in this time of COVID. We don't want people, traveling or doing unnecessary trips. So, we really, try to focus on, being, mission driven, right? Really trying to always strive for ways to, help the consumers and the personal assistants in our program, and helping them navigate this. Now, why CDPAP, right? Because there's other different types of home care models, and I'm going to outline some of those reasons here. So there's actually no limit to the amount of personal assistants that can be hired. So if Centerlight comes in and they approve the consumer for 40 weekly hours, if the family likes, they could sign up 20 personal assistants, right? They can sign up 2 personal assistants. So, and we as a CDPAP fiscal intermediary, we recommend that you guys sign up as many as possible. Just because, we want you to be prepared in case someone calls out, right? Having a backup in place. Because going back to the responsibilities of a consumer or representative in this program, that's one of the responsibilities, making sure that you have an adequate amount of staff with a backup in place. In CDPAP, there's also a weekly bucket of hours, right? Because as a consumer or designated representative, you are in charge of scheduling the shifts, not the agency, not the health plan. You're in charge of that. So if you're given the 40 weekly hours, let's say, you can one week you can use up all the hours during the weekdays, and the next week you can use it on maybe Friday, Saturday, Sunday. So having that flexibility is something that we see really help those consumers self-direct their care, or those representatives help direct their care as well. Now, we already discussed this, but this is also something that really sets this program you know, really separates this program from a lot of the other home care models in that family and friends are allowed to be the personal assistants. They don't need any certifications. They don't need, they don't have to go into the office to do an in-service or training and stuff like that. All of that is done by the consumer or the representative. And we've also seen this program help with a lot of the cultural and the language barriers. So for those families where maybe they would prefer somebody that speaks their language, or they are in their same culture and they know the whole atmosphere of how things work in the home. This is something where having a family member or a friend that is already acquainted, really does help. So we have seen that be a big reason of why people choose CDPAP. Now, personal assistants can perform tasks from what's called instrumental activities of daily living, those tasks that help the consumer live independently, like maybe cleaning the room, laundry, doing essential errands, all the way up to those skilled nursing tasks. Now, this is another big draw, right? Because a lot of the other home care models don't allow for the aides to do the medication administration and the other different nursing level of care. So, this is a huge thing, and I see people literally use CDPAP only for this reason. The consumer or representative has that total control in the whole onboarding of the personal assistant. So they're the ones that call them up and do the screening. Can you come to HOPOG and care for my dad or my son? I have a dog. Is that okay with you? So they're the one that does that whole screening. They're the one that does the interview. And once they find that personal assistant is a good fit, then you come to Premier, right? And we take care a lot of the back end paperwork, making sure that they get the proper medical forms filled out and stuff like that, so that they can start to work. Now, the consumer, as I mentioned before, they're the ones that manage the plan of care, and with that comes the training and the scheduling. And this program, I see it as having a pretty low barrier to entry and a low barrier to enroll if you're trying to be a consumer or a personal assistant in the program. We typically say at Premier that when it comes to the amount of time that it may take for somebody to start services, especially if they're already approved by, if they're already approved to have CDPAP services by let's say Centerlight, right? And if they come to us, then it could literally take a couple of days, if they get their medical forms to us and they fill out our online application. So it's really up to the motivation of, when that consumer or when that personal assistant wants to get those forms to us. So I'm also going to bust some myths about CDPAP. There was an individual that I spoke with a couple of years ago. He could actually lift like 400 pounds in the gym. And the mother contacted me and asked if he would potentially be eligible for CDPAP. And if you remember what I mentioned before, what came to my mind was that, yes, there are those nursing level of services that people can utilize if they're in CDPAP, but there's also those instrumental activities of daily living, those items that help the individual live independently, like the cleaning and the laundry, or some of those ADLs, like maybe helping with shaving and stuff like that. And that's exactly what this individual needed help with. So they ended up getting approved, and now the parents were actually caring for this individual and getting paid for it, because the consumer was 21 or older. He was actually in his 30s. So, this is a myth that I see a lot of people kind of get confused on, So if you feel that this program is only for those that have severe medical needs, I'm here to, bust that myth. Another thing about this program is it's not for supervising, monitoring, babysitting, right? This program is solely based on those tasks that the individual needs help with. So when a nurse from Centerlight does the assessment, or if the individual is straight Medicaid, if it's a social services nurse, they're not going to give out hours based on, babysitting or supervising the individual. So think about those actual tasks that the individual needs help with. Think about on their worst day, what do they need help with? Because those are the kind of services that you want to be prepared for. And there is no minimum or maximum age for a consumer to be eligible. So as you guys remember, in the eligibility requirements, that wasn't a requirement. You didn't have to be 18 or older, and don't get that confused with the personal assistant requirements. Personal assistant does have to be 18 or older. This is talking about the consumer. There's no minimum or maximum age. So we have, children, we have World War II veterans. So, there's a huge range of, when it comes to, individuals with different types of disabilities and, ages. So this program does not discriminate. And this is actually something that, I actually communicated with Department of Health, because I've seen a lot of people have questions about this. And they did confirm that the consumer's health proxy and the power of attorney are actually allowed to be the personal assistants. So you may run across that. And if you ever run into problems with that, you can contact me, and I can help you out with that. So CDPAP, the future of CDPAP, there are a lot of different things going on. You may hear some news. There's something called a RFO, which is a request for offers. Basically, what's going to be happening is there's going to be a consolidation happening, where currently there's 600 fiscal intermediaries, and the latest estimate is it could be anywhere between 5 to 25 that remain. And this decision is expected in the first quarter of 2021. So, and as a larger agency, one that also has experience in this new reimbursement structure that we will be getting, which is called the per member per month, we are confident that we will be one of those fiscal intermediaries that are chosen, and we want to be that that option for you guys. If maybe you're with a fiscal intermediary and they discontinue operations, we are there to assist. Like I said before, we have built a very streamlined online application process, and we try to make things as easy as possible for you guys. And this is some of our contact information. We have our Assistant VP Megan's information here. We have the CDPAP department, my information here as well. Like I said, my email is also on the flyer to this event. So you can feel free to email me with any questions. We can, schedule a call to discuss any specifics about your situation. But that concludes the CDPAP portion of this. So thanks a lot, guys, and I hope everybody stays safe.
Thank you, Joe. I'm just going to take back permission as host. Bear with me 1 second.
All right.
A lot of great questions came in during that one. So we have actually been having a little bit of technical difficulty with the team from SCS Pooled Trust. Mark, who was originally supposed to be presenting, isn't able to make it, so his colleague Mike is trying to log in. So we can give him a few minutes to log in and see if he actually can join us. But I figured in the interim, we could actually start going over some of these questions that have come in through the chat. So the very first one is directed towards Centerlight. And as we're answering these questions, please keep sending in your questions. I'll add it to my list. Okay, so the very first question for Centerlight, Danny and Stephanie, if you want to answer, can handicapped adults use the PACE program?
I can answer that. Yes. I'm not sure. So are you guys talking about like wheelchairs or diagnoses? But we can handle all types of medical diagnoses, and we are handicap accessible. So our buildings have elevators, we have ramps if needed. So, and then for transportation, I know Danny mentioned car services, But if they are permanently on a wheelchair, we also offer ambulette services that can take your loved one with their wheelchair. And if they're bedbound and they can't get out, we can also provide ambulance service. So we have a whole range of different transportation types to get you to and from our centers, as well as to your medical appointments. And if we are helping you choose a doctor, we can also verify with the doctor's office if they are handicap accessible to accommodate your needs. So we definitely do accept.
Excellent. And now we had a similar question come in for Premier for CDPAP. I guess I'll take the answering this question if you don't mind, Joe. This question is CDPAP used just for the elderly population or for other populations, other communities as well? So as Joe had mentioned during one of the first slides, the history of CDPAP, CDPAP actually came into existence in the 80s, developed by a group of individuals who were disabled because they weren't happy with traditional home care in which an agency comes in and sends a stranger into their home to care for them. They wanted more independence, autonomy, they wanted to feel more empowered. And so they created the consumer-directed personal assistance model of home care for New York State back in the 80s. And like Joe had mentioned, it's great for the geriatric population, it's great for the disabled population, and it's very widely used specifically for the special needs population. A lot of individuals with special needs use CDPAP, no matter what age. And they usually use it in tandem with a different program called Self-Direction. If you would like more information about that, you can always email me. If you'd like, you can, I think I put my email in my chat. Let me just email or write down my email address in the chat for everybody. The next question that I have here that I'll let Joe answer is how does, and maybe, maybe even Danny and Stephanie can answer as well. How does CDPAP coordinate with PACE and any other MLTC?
Sure. So I did touch upon it briefly in the presentation. Now, Centerlight through the PACE program, they're really the entity that administers the program. They're the one that determine if the individual is eligible for CDPAP, whereas Premier, as the fiscal intermediary, we are the entity that handles the payroll, and assisting with some of the back-end paperwork, and helping the consumer navigate this particular program. And I'm not sure if Danny or Stephanie, if you want to elaborate a little bit more.
I can jump in. So how Centerlight would work with Premier and the CDPAS program is if you join Centerlight and you express from the time you're signing up, you're interested in CDPAS, we will help you with the application process. We will tell you how many people you need based on the hours you're approved for. And how we determine that is the whole IDT team will come and make an assessment. They would assess what your loved one needs help with, certain tasks like cooking, cleaning, bathing, grooming, those types of things. So we would determine how many hours you're approved for weekly, and then we would provide that information to Joe's team, but we would help you start on the application process. There's fingerprinting that gets involved, but we walk you through every step. We have a designated CDPAS person on our team who's not on this meeting now, but they will help you with the process. We do the assessments, and then Joe's team does the payroll, like he said.
That's right. Think of Premier CDPAP like the back end process where the administrators in the back end just purely processing your caregiver's payroll and benefits in the back office, so that the consumer can act as the director of their own services, as the true boss, the head honcho. We're really not involved, and that's why a lot of people like to use CDPAP because of the privacy aspect. And actually, that is a good way for me to dive into the next question that we just got. And I guess we're going to ask this to first Centerlight, and then I'll answer it for Premier. Are in-home assessments still required during the pandemic?
So we are still doing in-home assessments for start of care, but you have the right to refuse. So if you don't feel comfortable and you don't feel safe, you can tell us upfront that you are available for, we do telehealth, so we can do FaceTime. We also have our own program that's HIPAA protected. It's called Tiger Connect. Our IT department can help you get set up with it. But if you don't, we can use FaceTime or WhatsApp and do a video assessment. We prefer to do in person. And I just want to double back on the COVID-19 precautions. I forgot to mention earlier. I want to reassure you guys that all of our team members that are seeing patients in the community in their homes, they are required by our HR department to get weekly COVID testing. So all of our nurses, social workers, whoever is out in the field seeing participants in person, they are required weekly to get tested for COVID, and they are not allowed to be back to see another participant until we get those negative test results back. So you can rest assured that every person that you come into contact with as Centerlight are getting COVID tested weekly. So that even if you still feel uncomfortable, that is totally fine, and we don't have to come to your home, but we like to at least on the first visit so that our nurse can really get to know you.
Great, and I'll answer that just for Premier. So what we did here at Premier, we understand the need for, well, first for people to, not necessarily want strangers in their home during the pandemic, but also secondly, going back to the theme and the mission of CDPAP, which is allowing the consumer to direct their own care and to have that privacy and that independence. We here at Premier developed this online enrollment system so that everyone, the consumer and their caregivers, can enroll online from the comfort, safety, and leisure of their own homes. And like I said, it's fully automated, fully online process. So that's what we have here to offer at Premier. So the next question that just came in for Stephanie and Danny, somebody asked, is Centerlight available in Suffolk County? Because they had requested, I guess, from a resource of theirs, which MLTCs they could use, and Centerlight was crossed out.
So I'll actually answer that. Yeah, I mean, we do offer coverage in the Suffolk and Nassau County, but because it's pretty vast over there, there may be some zip codes that are not within the coverage area. So if you give me your zip code, I can definitely find out for you for sure.
That's great. Okay, so another question that came in was, is there going to be a recording available of this workshop? Yes. So I did put in the chat my email address. If you just email me after the workshop, we're going to have that recording ready and able to send out to everybody first thing tomorrow morning. Just send me an email and I'll send it over your way. Joe, now here's a question for you. Somebody asked, how is CDPAP different from having a home health aide through an agency?
Sure. So, I would say the biggest fundamental difference is that CDPAP, it's consumer directed. So the consumer has basically all of the say when it comes to who comes into the home, right? The agency is not the entity that is in charge of that. So if somebody gets services through a licensed home care agency, and they are getting a home health aide, that home health aide is recruited, screened, and trained by the agency, and then the agency sends that individual to the patient. Whereas in CDPAP, the consumer does the recruiting and the screening and the training, and does the whole managing of the care after that, right? And is even in charge of having a backup. And a lot of, unless the patient can get a nurse, if they're getting services through a licensed home care agency, the other home care models don't allow, like getting a home health aide. They don't allow those aides to do the nursing level of care. So as I mentioned, like the medication administration or wound care, stuff like that, those are things that can be done in CDPAP. Whereas if a home health aide comes in, they cannot perform those tests. So that's what I would say are the biggest differences. You also have the fact that CDPAP, when it comes to scheduling, they get that weekly bucket of hours, and the consumer can schedule. Whereas in a licensed home care agency, if somebody's getting a home health aide, the health plan determines the specific schedule of the hours for the patient.
Thanks, Joe. Okay, so the next question that came in is, when is the next workshop? So I'm a little bit hurt. Did you not get what you wanted from this workshop? No, I'm just kidding. So if you want to invite more people, friends, family to the next workshop, we have these quite often, and they cover a range of different topics. But if you need to get your fix in before the next workshop, Premier CDPAP actually has our own YouTube channel. And if you'd like, you can just email me and I can just easily send you over the link. That way you and your family and your loved ones can watch all of our YouTube channels at your leisure. I think, like I said, they cover a variety of topics. And a lot of them are only like, 2-minute or 5-minute videos. So it's very easy just to watch quickly to get your questions answered. We also have a variety of different other social media platforms. We're on LinkedIn, we're on Facebook, we're on Instagram, we're on Pinterest. So like I said, just email me and I can send all of that to you, because then we also have a calendar that updates with upcoming events, whether it's in-person workshops or conferences, community events, or a virtual workshop like this one tonight. So another question that came in, I guess
Megan, I'm sorry if I could just step in, because I know Centerlight has some awesome things going on too. So Danny, if you could just touch on a little, stuff that you guys do.
Yeah, absolutely. Thank you very much for that, Joe. So yeah, just like Joe said, we are following the New York City guidelines right now, and the adult daycare centers are currently closed for socialization. So instead of offering those services in person, we're actually offering those virtually through our Facebook events. And the great thing about these events are that you don't have to be a Centerlight member to view these events. You don't even need Facebook to join these events. All you have to do is let us know you're interested. We'll send you a link, and you can just click on that link and you'll be able to join us. During these Facebook events, we have music, we have dance lessons, we have cooking lessons, and every Friday we do have a bingo game where all players do have a chance to win a prize that'll be mailed directly to their homes. So yeah, I mean, it's a great opportunity for people in the community who haven't really had the opportunity to go out lately because of the pandemic. It's just a nice breath of fresh air for those kind of people. So if you are interested in the Facebook events, please let me know, let Joe or Megan know, and we'll send you the link right away. Thank you.
Of course. Yeah, I'm so sorry that I completely skipped over that. We post Centerlight's events every Friday on our Facebook page. So, if you just link with us on Facebook, you'll see it. So the next question, I remember actually seeing this bullet pointed on your slideshow, Joe. Somebody asked if we could better explain how CDPAP helps cultural and language barriers. So the language barriers, it's pretty self-explanatory, right? In CDPAP, the consumer, the person receiving the services, can hire basically anybody that they choose from, with just a few exceptions, right? It can't be the legal spouse. That person has to be over the age of 18. But think about all of those specific communities who want to hire somebody who speaks their language, that really solves the language barrier issue. They can hire somebody that they know, maybe that's their neighbor that speaks their own language, or from church, or from community events that they do, right? So then the other cultural barriers that CDPAP helps, I just remember from my own experience when I worked on the traditional home care side of Premier as a staffing coordinator, a lot of times clients would call me upset because maybe a home health aide that was sent from the agency wasn't familiar with a kosher kitchen home, right? Or maybe they didn't wash their hands as frequently as a certain culture wanted them to, or maybe they didn't take off their shoes before entering the home, and that was very specific to a certain culture. So in these ways, CDPAP is really beneficial for a lot of people because, like I said, they can hire someone that they know, that they trust, and that they love potentially, that already understands their culture. So I hope that that better explains that. So then a question came in, Joe, this question is for you. Can individuals with community Medicaid use CDPAP?
Yes. Yeah. So if somebody's on Medicaid and not enrolled in a managed care plan, like Centerlight, then they could still receive CDPAP through either the Social Services Office, which is also known as the Human Resources Administration, HRA, in New York City. And depending on your specific situation, you can always, reach out to me directly, so I can double check it in the state system. That way, because that is a good question, right? Because in order for you to start the process, you have to ultimately know where to send that physician order form to, right? That initial medical form that has to be done by the consumer's doctor. So community Medicaid without a health plan, also known as like a Medicaid managed care plan, would go through social services for your county.
Great. Another question that came in, I'll answer it, and then Joe, you can definitely chime in if you'd like. Could we better explain what that RFO means? So we talked about an acronym, RFO. It stands for Request for Offers. So let's just backtrack for a second. Historically, in New York State, fiscal intermediaries, right? Agencies that provide the CDPAP services did not have to go through a licensing process, a certification process, or any application process to start up their business. So as you can imagine, any mom and pop shop who wanted to set up business, maybe in their basement as a CDPAP fiscal intermediary, could do so. So New York State obviously started recognizing this, over the course of, quite a few years since the 80s, that more and more CDPAP fiscal intermediaries were popping up. And realistically, New York State cannot, conduct their checks and balances, their auditing processes, their surveys to make sure that everybody's doing what they're supposed to be doing and not committing Medicaid fraud, not, doing things under the table, things like that. There's no way that New York State could oversee about 700 different agencies that provide CDPAP services. So what they implemented is this RFO, and that was, I believe, early last year that they implemented it. This request for offers. It's essentially an application process that any CDPAP fiscal intermediary that wanted to continue doing business had to apply in a very lengthy process, very arduous, but that's to, the community's benefit, because that means that New York State is going to reduce the number of people who can provide CDPAP services from about 700 to potentially a maximum of 25. And that's really good because then they're going to be able to double check to make sure that everybody's doing the right thing. And, and all the Medicaid dollars are going to the consumer services. So that is for your benefit. And we are confident here at Premier that we will be chosen as one of the remaining FIs, fiscal intermediaries, because we're the only agency that provides CDPAP services that's affiliated with any union. We're affiliated with the 1199 Healthcare Workers Union, and that's major because when you think about it, individuals who want home care and they're shopping around for home care or CDPAP services, the very first thing that they ask all of these different agencies is, what's in it for my caregiver, right? Because you're usually thinking about that person in your head. So say I wanted home care services and I had my buddy Joe, and I was thinking, all right, I want to enroll into CDPAP with my buddy Joe as my caregiver. However, I want to make sure that he gets the best wages, the best benefits. So let me shop around. So the fact that we provide the 1199 benefits, which include a mix of education fund, 7 days worth of vacation pay, health benefits, and union advocacy, that's major. And we're the only agency that does that. We're also one of the few agencies that provide CDPAP services that is statewide. So we like to say that we can help you no matter what. right? No matter where you live, what managed long-term care plan you have, although we ask that you choose Centerlight, but we can help you no matter what. And then lastly, like Joe mentioned, we are very familiar with this new reimbursement model that New York State is implementing called per member per month. And you don't need to know the specifics. It's just a different type of calculation of which New York State reimburses our agency. But that's neither here nor there, because all that you need to know is the fact that we support it. We're behind New York State's decision to implement this new payment method, and we understand how to work within it. Whereas other agencies, they're trying to go against this. So we're with New York State. We're moving forward with New York State, and that's why we're confident that we're going to be chosen. So what that means for you is you can confidently choose to enroll with Premier and not worry about us getting shut down in a couple of months or so. If you choose to enroll with a different agency, I can't promise you that they'll still be around in a couple of months after the RFO decision. Okay. I just saw a bunch of people saying, "Oh wow," in the chat. Yeah, that's great. I'm glad. I like to see that reaction. Are there any other questions? That concludes the questions that I jotted down. Is there anything else that Danny or Stephanie or Joe would like to add?
Yeah, really quickly, I know that someone asked if the zip code that they're currently residing in is covered. To that person, yes, I did check both zip codes and they are within our coverage area. So I would really love to speak with you. If Megan could give me the name and the contact information afterwards, I'll definitely reach out to you directly. Thank you.
I also want to just touch back on the in-home visits. If you are uncomfortable with having in-home visits, another option is that we can bring your loved one into one of our centers and the nurse can meet them there and do the assessment in our clinics. And just keep in mind, our clinic is not open to the public. There won't be other patients there, only Centerlight members. But right now, our clinics are open. We're only closed for socialization, but our doctors and nurses are on site. Specific sites are open right now. And then we have some sites that we rotate through, but you will be able to access one of our clinics that's closest to you, and the team can meet you there so that if you don't want them in your home, if you have young kids, grandchildren, elderly parents that you don't want necessary exposure to, we can also accommodate. We can bring them into the center, or we can come in your home if you are comfortable. So that is another option. We can have all the team members meet you at like Flushing site is open now, Monday to Friday. Our clinic is open, and we are scheduling appointments where social distancing is practiced. We are not double booking appointments. We shouldn't have more than 1 or 2 participants there. And even if they are, we have different rooms that they're waiting in so that they're not sitting next to somebody. So they can come in with their CDPAP representative, and then our team can do their assessments there, and then we can provide transportation back home. So that's an alternative from seeing them in the home.
Excellent. Joe, do you have anything you want to add?
Oh, just, thanks again, everybody, for joining us here. And, like I said, feel free to reach out to me, and I'll be willing to answer any questions that you guys have. So thank you.
Well, you didn't have to wait too long, Joe, because a question just came in for us.
Wow.
So somebody just asked, if the consumer has straight Medicaid, how do we get CDPAP started?
So first step, regardless of if you're straight Medicaid or if you are in a managed care plan, get that physician order form done. So my email's in the, or you can email Megan as well, either one of us. Mine's in the flyer for this event, and I'll send you an email right back with that medical form. That medical form has to be filled out by the consumer's doctor. Once it's filled out, then depending on the county that you're in, then it gets sent to that social services office in that county. Once they review that form, then they'll send out a nurse to assess the consumer and then hopefully approve them for the services. After that, then you can choose a CDPAP agency. All right?
Excellent. Any other questions? No? Okay, so what I'm going to do is I'm just going to put on our screen, let's see, just some of Premier's contact information, but like Joe mentioned, everyone's contact information was in that flyer that was getting posted around on LinkedIn and Facebook and via email. So if you'd like, you can either email anybody here that you see on your screen. And if you'd like, we can connect you with the pooled trust team that wasn't able to join us today, or the Centerlight team, Danny and Stephanie. So you just email us and we'll connect you all. Okay. All right, so that concludes our workshop. Thank you everyone for joining us. We hope that we see you next time, and maybe even some friends and family members. Have a great evening and stay safe. Bye-bye.
Thank you, everybody.